My name is Noah Fay. I'm the Director of Housing Programs with DESC. That role means I oversee our permanent supportive housing programming and our emergency shelter programming. DESC is a service provider who targets serving people who are single adults with histories of experiencing homelessness and really significant and serious underlying challenges and disabilities. So our primary population group are people living with often major behavioral healthcare challenges, so serious mental illness, substance use disorders, and often major physical disabilities as well. All pretty much every way it's changed. So in our housing programs, where we run permanent supportive housing, which I don't know if everybody's familiar with what that is, but that's housing for people who have long histories of homelessness prior, where they move in, where services are offered to help them retain their housing and live the highest quality of life possible in a voluntary fashion, with no preconditions that people accept treatment of any kind, but instead are offered and outreach to try to engage in services as needed and as desired. And so in those programs, we tried to do everything we can to make it as easy as possible for people to stay at home and follow the stay at home order without risking connection to services and food. So, for example, we increased the food meals that were offered in the program and started delivering those door to door. We tried to connect people with telehealth services so they remain connected to their outpatient behavioral health care providers as best they could. That's been really challenging, to be honest. That's definitely been a big challenge. We've also peeled back and limited visitors in programming and stopped doing community activities to limit how often people connect with one another and have close contacts with one another to avoid spreading COVID. But that also is just a challenge. People have less connection to supports than they had before. And our shelter programming, we've made even more dramatic changes where we have realized we've long questioned and struggled with the congregate shelter model, in part because it's just a pretty difficult environment in many different ways where it's very high stress, it's very crowded. In our case, people are living in very close quarters with other people who also have pretty major challenges. So it's a pretty stimulating environment, which is not always ideal for people with pretty major challenges. So we've been thinking about ways of decongesting our shelter for years. As COVID came, we realized we didn't have time to plan anymore, and we needed to find a way to decongest shelters as much as possible and de-intensify them. So we moved out people in our most heavy congregate settings, some into individual motel rooms around the community, some into a more open air, large scale shelter where people had more space between one another. Quickly realized that itself wasn't good enough either, though, and moved a number of people who were in some of our most crowded shelters into a hotel that we've been running in Renton for the last 8 months. So people would have their own individual rooms or a room with a roommate to avoid all the close contacts people normally would have had in a congregate shelter. Yeah, I mean, the clients that DSC serve have kind of historically fallen through the cracks in our social service net even before the pandemic, just because their challenges are so great, and their needs are so significant that many existing social services, even those targeting people who have histories of homelessness, they're not a great fit for. So that has just made it harder for our clients to get indoors. Shelter beds are harder to come by than ever before as people are staying in shelter longer, it seems, and not leaving shelter beds night after night, which sometimes we would see happen. People are kind of hunkering down in a way that frankly surprised us. So it's harder for people to get into shelter. Getting connected to all of the outpatient behavioral and physical health care that our clients need, there's just less availability for that. And we're seeing definitely some community-wide stigma as we try to find ways to broaden resources for people outside of the same traditional locations that we've offered services for years for our clients. A lot of communities pushing back on that out of concerns around not wanting to serve our population. Yeah, we've stopped in-person volunteering throughout this. We We don't necessarily rely on volunteers for day-to-day programming in our DSC. We certainly do for all sorts of additions and ads, and volunteers are an amazing resource for us. But we don't rely on them for the day-to-day 24/7 programming we offer. So we've not had to change our programming in terms of like the basic services we offer people, but in terms of added new events, activities, outings, meals, the stuff that volunteers historically provided for our clientele, we've had to stop that just to limit the risk of exposure. The our current our county has launched a effort to create a 1/10 of 1% sales tax that is aimed at securing more hotels or other permanent locations for people so that we don't lean on congregate shelter both during and after the pandemic, and also in an effort to help create more permanent housing opportunities for people. And that's one that's going to be really interesting to watch because it relies on a kind of a joint effort across our community and not something that is siloed in individual cities or jurisdictions. Meaning we're going to need a kind of that community-wide regional approach to homelessness that we've talked about for a long time, but that has actually been a little bit elusive in our community. So that is something to watch as we move forward, how that spending plan gets used. The Help Through Housing initiative too here in Seattle itself specifically, that's local to, or just relevant to just the city of Seattle, not all of King County, is also a potentially really powerful new resource to develop housing resources for people. And watching how that gets implemented will be key. I don't think so. I look forward to being able to have more volunteers on site when this is all through. It'll be great. So yeah, feel free to think of DSC, and happy to be a resource any way we can if you have other questions.
Okay.